Hello, everybody. Hi, good evening, everyone. I'm Dr. Vinod Babu. I'm the consultant diabetologist at Dr. Mohan's Diabetes Center in Indiranagar, Bangalore. Today, we're going to talk about the latest. Put a comment. That would be really great. Uh, how the sensors, the technology has evolved in identifying which person's sugars are high, and we'll give you the background about it. So, last time we talked about how important it is. Damages the nerves as well as the blood vessels. So, depending upon blood vessels we take to the brain. And of course, leg disease, wherein people wounds don't heal fast like a normal person. That also is a complication of diabetes itself. In addition to that, now damage leads to kidney disease and eye disease. These are the main five complications that we are worried about when somebody has diabetes. And as you all know, there is no cure for diabetes. It is a manageable disease, very much manageable. So every 3 months, we suggest you to go to your doctor wherever you are. Please go to the nearest diabetologist and check your HbA1c. This is the gold standard from the beginning because sugars tend to vary every day. If you check sugar now and then check it with the same glucometer again, it will give a different value. What is the reason? Because the glucose itself is a continuous parameter. It is a variable. It varies a lot. So because of this effect of metabolism as well as the hormones and several other internal and external factors, including the glucose values tend to change, tend to vary a lot. So how do we know a person's sugar is under control or not? So the gold standard by which we go these days until now is the HbA1c. HbA1c is nothing but it's a test which will tell you what is the average sugar in the last 3 months. If suppose your sugar is high, your HbA1c when you do that and HbA1c comes to little high 6.5, then we call it as diabetes. People who are having diabetes, they need to maintain their HbA1c to levels less. People, we can have a liberal target of 7.5. So has some certain drawbacks. It does not, and low sugars a day, which happens a lot actually, more common than many people think. So in such cases, HbA1c value will not reflect the true picture which is going on. So sugars vary a lot. Some people have a tendency to have low sugars in the middle of the night, which is very dangerous. And then when you check before lunch or after lunch or before dinner, after dinner, they tend to high sugars. So look, thinking that they have high sugars, they either increase the medication or the insulin dose and thereby increasing the chances of going into low sugars in the middle of the night. So this is what we call nocturnal hypoglycemia. Hypoglycemia, when it occurs in the daytime, it's different because during daytime, patient will be awake and the neurological signs we can expect in case of a low sugar, like giddiness, sweating, and palpitations. Generally, the awareness, what we call this awareness, will be intact during the daytime. Whereas if the same occurs in the nighttime, this is a sure short recipe for disaster. So these kind of every diabetic needs to be aware about this nighttime low sugars. So if anybody is having low sugars, yes, that is more going to control diabetes. That's the most important point that every diabetic needs to whether remember whether you are on tablets or insulin. Achieving your target without having low sugars forms the most important criteria as to determine who is well managed as to who is not well managed. So, in this regard, so how do we check the HbA1c? HbA1c, it's a lab test. So you need to go to the lab every 3 months and get it tested, and that will tell. But do we wait for 3 months? It will only tell the data for the previous 3 months, correct? So whatever has already happened, it will tell you. But so basically, glucometer is the one which we suggest, which we used to suggest until now, wherein we used to tell the patients you need to monitor the blood glucose, giving the targets like fasting sugar if it is below between 80 to 160. Yes, if you are within this range, you are more likely to get your HbA1c to 7. So that used to be a rough guide which gives an instantaneous results with the patients, though it's not very accurate. Uh, these kind of self-monitoring tools, self-monitoring of blood glucose is very much beneficial for the patients to monitor their sugar levels. So now the recent advances, the latest advances in the last 2 3 years, we have sensors. Wherein it's a sensor is a small sticky gadget. It's like a small sticker which we attach to the arm to the patient, which can track the sugars 24 hours. Every 15 minutes, every 5 minutes, it will track the sugars. It will check where is the sugar and then store the data on itself. So this is called as continuous glucose monitor. I'm going to show you a copy, and we will also take the questions as well in the chat box. So if you have any, please post them in the chat box so that I can answer all the questions to the best of my ability, and we'll go forward with the session. So here, freestyle Libre Pro. So what is the job of this? Why we should use this mainly? So mainly this sensor gives a better data. Means instead of checking one particular value in a day, or 4 points or 6 times in a day, this gives a continuous trend as to where a person's sugar is going, whether it is dipping down or coming low, in the form of a graph when you take the data. So the one I'm going to show you is the little older version called as Libre Pro. So, and the newer version is called simply Libre. So it's opposite. Usually, when something is branded as Pro, we think that that is the most costlier one, or the latest one, or the feature rich one. But in this case, About is the company. Somehow, because of some marketing issues, Freestyle Libre Pro is considered the first version, whereas Libre is the newer version. I'll tell you the difference between the two. First, let's go through this data. So let's go through how this works, and then how can the doctor know where the person's sugars are, because these days, any day, our decisions as a doctor we take with respect to which medicine that the patient should be taking is based on labs, as opposed to some other fever or cough or any other illness where we need to look for certain physical signs and symptoms by examining the patient. In diabetes, it is all about numbers. The more data you have, the doctor will be more confident about making those changes so as to get your HbA1c target. So if I, it would be very easy for me, to titrate the medicine dose or insulin dose depending upon how they are working inside you. If you have data to see how this medicine, because as you know, every medicine is different. Every medicine works differently in different people. Same paracetamol will not bring down the fever in some, whereas some people, half dose of paracetamol itself will bring down the fever. So by drawing the same conclusion here, if you see, the same amount of insulin produces 30 mg drop, 30 mg points drop in one person, whereas some people with high insulin resistance, it will not even produce 10-point drop in the insulin. That is how the medicine works. It is not always exact like physics or chemistry. So where one plus one is always equals to two. So in order in this area, in this age, when we have technology wherein we can continue accurately measure the blood sugars, what is going on with your sugars, if we can get to know the data and the trends, we can identify certain dangerous trends like nocturnal hypoglycemia, nighttime low sugars, as well as we can identify when a person's diet, which parts of the diet is actually causing to increase in sugars. We can identify that and then make changes which are particular to that person. If I eat rice or wheat or ragi, these are the high carb foods that I have told you before. So these carbohydrate foods, rice, wheat, and ragi, all three, if eaten in large quantities, so that will lead to jump up in the sugar levels. You all know that. So in order to avoid that, the same amount of rice eaten in different part of the day, when pancreas is producing better insulin than at the time, will lead to lesser amount of glucose rice. So even in the same person, same food produces different type of response in different days and in the same day also. So today's we are talking about precision diabetes, identifying how the fluctuations of sugars are going on and treating the patient with the best of the medicine available right now. That is the main crew of diabetes management, and I believe that is the way going forward as well, because CGMs have been there in Western countries, but adaptation in India is a bit slow because the Indians don't accept anything new. They want to go with the time tested methodology only, time tested methods only. That is the problem. Adaptation of technology is a bit slow in our community because of various social factors as well as economical factors as well. So today, without much to do, this is the CGM sensor this is the first generation sensor called as Freestyle Libre Pro. This is the box it comes with. So when you open and you get one applicator, you get two devices like this with an instruction sheet as well how to use this. Okay, this is the applicator. So in this, just need to, of course, it is advisable for you to person, not by yourself. So you can see this is the sensor which is present inside the applicator. So what we need to do when we are using, because you can, the sensor is useless. So this costs around 2,500 rupees, 2,200 I believe. If now the price has been reduced. So that's the beauty of technology. The more people use it, the price will come down. So if you look at it, the sensor is present here. I'll try to remove it and show it to you. So basically, you need to, hold it like this, keep it inside, and then once you load it, the sensor will be inside. Applicator will have the sensor, and then you you apply the patient, and you apply ask the patient to clean the area. We clean the area with sterile swab and look out, identify which areas are better, and then you apply this like this. When you do like this, like a stapler, it will go and get stuck. So it is virtually pain free. Very few people tend to have some pain, some amount of one drop of blood. It's very rare. So it's a painless way. And many people ask the question whether this thing will work when you're taking bath, or whether we need to remove it. No, once you apply this sensor, this is the one which gets stuck to your skin. So imagine this is my shoulder, arm. It will get stuck like this. See, there is no needle. I am also putting it on my skin. But there is a small filament here which will, go into, when you are applying for the first time, it will go into the skin, and it will stay in the place between the cells, what we call interstitial fluid. Interstitial fluid. It measures the glucose from that fluid. Whereas traditionally, when we go to the lab and we take the blood from the veins, that is the venous blood, which is the gold standard for all diagnoses as well as monitoring. All our targets are based on that. So fasting sugar, when we say go to the lab, it should be below 120. Yes, that is the venous blood. Whereas the one which you use your glucose meter is called as finger stick. Finger stick glucometer is the finger. It is the capillary blood, means the smaller blood vessels. The blood vessels in the arm, it gets bifurcated, and they get they become smaller and smaller, and they become the capillary blood here. Obviously, the blood here is different than the one which you take in the arm, and at the same time, interstitial fluid, the one which this sensor measures, is also different. So, how do these three compare? So, venous blood is the gold standard, whereas the capillary blood, which you get by the pricking the glucometer in your fingers, this one tends to show little lesser values, on an average 10. We suggest the patient to monitor that. That serves as a rough guide as to where sugars are, and it should serve as a guide for adjusting the insulin doses for patients who are on insulin. So this sensor again works on the interstitial thread, the space in between the cells. Okay, so this correlates better to the venous blood rather than the glucometer values. They tend to fluctuate a lot. It depends a lot because this is the end of the arm where you are checking. So whereas this one you are writing at the arm, your arm itself. So when this will keep checking the sugars and keep saving the data onto its memory, which is present inside this chip. Okay. So at the end of the 14 days, so patients needs to wear this for 14 days. It will keep tracking like Chitragupta, okay, taking note of all your dates. So whether good or bad, they'll keep tracking, right? So whether low sugar or high sugar, it keeps tracking your sugars for 14 days. So you can wear it even while sleeping, while bathing, while playing, whatever activity you do. Just ensure that you don't sweat too much. If you sweat too much, just like with any adhesive, this adhesive also will come off easily. At that time, what we simply suggest is put an additional layer of tape on top of it so that it won't come off. So this is the main purpose. This is how it works. At the end of the 14 days, then we need to get what we call reader. This will not be sold with the device. This will be present with your healthcare provider, dietitian, or doctors. So in this sensor, of course, even when you put it on the first day, you need to activate using a reader. Then only it starts recording. So it records the data only for 14 days. It is not reusable. After 14 days, you need to throw it into the dustbin, including every apparatus, all these, whichever applicator which comes with the Libre Pro, all these parts. These are only used once. So after that, this gets discarded into the dustbin. So once you put in, you need to activate it using this sensor. This is the reader. You can see there are two options. One is the start new sensor, and the other one is to get the data. So it is simple. This is the older version. So we talk about the newer version. What are the differences later? A little later, after we take certain questions about this Libre Pro, the older device. So what is that advantage of this compared to the traditional way? We can get actually almost 1400 readings in a day, so that is the importance. We can get to know the trends. You see the sugar, it fluctuates. It gives it, sometimes it goes low, sometimes it goes high, so it will give the exact picture as to at which point of it, on which day. Today is 30th August, at 6:15 p.m. Vinod's blood sugar is this much. It will give that much. So this is, it cannot get better than anything else. Believe me, this is the one which is going to cure diabetes in the future, because data is all that matters here. So I'll tell you how CGM sensors are curing type 1 diabetes. I'll tell you in the end. Cure, there is a potential cure for diabetes which is already there working. But you need to get all the things right to do that. But this technology has revolutionized the way we practice. We doctors look at diabetes, and many things which we never used to expect before. The reactive hypoglycemia, Somogu phenomenon, Down phenomenon, all we can pick it up very easily in this, and thereby avoid unnecessary changes or unnecessary dose upgradations or diet titrations. Both can be avoided in this. So at the end of 40 days, you'll get a nice sheet with the data. The individual values also will be there, whereas a graphical representation will be given on which day your sugar fluctuated at what time, like this, in form of a graph. So more important than that, what do we get to know in that graph? There is something called as time in range. Time in range. This is still an evolving concept. More and more research is being done on this. So if a person's time in range is more than 70%, it is considered to be as good as having diabetes under control. So an ideal way of controlling someone's diabetes is by checking with the sensor to see if your average time in range for those 14 days is 70%. Means 70% of the time your sugars are in between the range of 80 to 150. So if you do that, if you get that, then yes, there is a good chance. It's even better than HbA1c 7.0. So it is like assured way that your sugars are perfectly under control. So that is the best part, and of course, it will record the low sugar events also. So even before a person knows that sugars are low, this device will record the low sugars, and thereby alerting the doctor to reduce the medicine. If somebody is having low sugars in the middle of the night, 3 o'clock, 4 o'clock, he may not be aware. He will be sleeping, and added to that, long-standing diabetes affects the nerves, and thereby the nerves will not give us these signals which we usually identify, like increase in heart rate, increase in hunger. You will not appreciate those when diabetes is there for a long time. Autonomic neuropathy will set in. Means damage to the nerves will happen in the all over the body. They will not identify those minor signals that a person's sugar is going low. So in the night time when a sugars go low, this device helps us in identify even before the patient knows it, and thereby reduce the nighttime dose of insulin or the tablets according to the patient. So that is the main advantage, and I'll show you, like, after some time we'll discuss about the importance of the newer generation CGMs and how these are being used in tandem with insulin pumps. So I'll explain you in simple words. So please bear with me. So we'll take some questions. Yes, Mr. Violu smiles. Yeah, good evening, sir. Good evening, everyone. So, and Kala Lakshmi, Mr. Kala, sorry, Mrs. Kala Lakshmi Nara Simhan. Okay. Today, my fasting sugar is 116 and postprandial is 146. Is it okay? Excellent. Fasting sugar, if your age is below 65 years, all we want is fasting sugar below 120 and after food sugar below 160. Then your likelihood of getting HbA1c below 7.0 is high. So, it's not just only the one meal. I would like to highlight here. So don't just focus on your first meal of the day. That's the breakfast. Always check one time if you're checking breakfast before food and after food. Check same before lunch and after lunch, and before dinner and after dinner. The targets remain the same. So if you are in a fasting state in the lunch, if you're not taking anything in between, yes, ideally it should be below 120. So that is the most important thing you need to look at. So how accurate are these by Mr. Venkat Gita? This is as best as it gets. As of now, this is the best technology we have in terms of predicting where a person's sugar is. Definitely, there is a difference between interstitial blood and the venous blood. With advancement in the technology used in this sensor, scenario. Earlier, we used to see this used to underestimate the HbA1c, but now with the newer generation devices, the accuracy is far better, and it is even exceeding the HbA1c, what we were thinking as gold standard. So one day, these sensors are going to replace your HbA1c. Every time you go, you need to get it and get it done. It will give you the entire graph. It will tell you the HbA1c as well in this, 14 days readings. So that's the importance of this. Yeah, Mr. Narasimhan Naidu. Yeah, price of this is, I believe, 2,200 rupees is what the current price is, and it varies center to center. And of course, even in Amazon these days it is available. But the product support, regarding how to apply this, and it needs to be applied in by a trained person. Because once if you click it and it doesn't apply well, that's waste of your 2,200 rupees. So I always suggest you to get it done, at a trained healthcare expert, or if you're somebody who has already learned it, yes, definitely you can do that. It's not much of a rocket science. You can do it as well. But interpretation and activation needs a reader. The reader needs to be purchased separately with this Libre Pro. This used to cost 10,000 before, but now I think it's costing around 5,500 rupees. This is the older version. Okay, there is a newer version. I'll talk about it later. So that's the price of it, and there is some bundle offers also there in Amazon as well as in many centers, even including our center. If you buy four, you'll get one in the newer version Libre. You'll get four sensors. You'll get the reader free. That kind of offers are also there, which is pretty much the same even in Amazon. So, Mrs. Parmeshwari Subramanian, I'm using it regularly for my Hindalco company employees. It was easy to explain to them about nocturnal variations, made my job easy, but now due to COVID, not used. Okay, very good. I'm happy to see some of you are adapting this technology. I personally know many of my patients who use it every 14 days, not just one time. People who don't want to take chances, who have the access to the resources, they don't think twice about using this technology. You just have to attach like a sticker, which is just like a band-aid, right? So you just apply a band-aid, it will tell you the information completely. And every 14 days, you keep track of your sugars better and then make adjustments to your medication by discussing with your healthcare provider. So it's as simple as it gets. It's like you're beating the diabetes. It's like a hack which you can do 24 hours a day for the rest of your lifetime to control your sugars better. So that's one thing. Yeah, and yeah, definitely it takes even the patients who look at the chart, they'll get more knowledge. Like seeing that, looking at the chart one time, I suggest all the type 2 diabetics, all type 2 diabetic patients to get it done one time at least in your life, because even if your sugars are controlled, you may not know where the sugars are going low, where the sugars are going high, which foods are causing high sugars. If you are somebody who wants to get the best value for money for your 2,200 rupees for those 14 days, write down when you're taking it only for the first time, write down the food that you're taking, including the timings. So when you compare with this data, you can easily identify which foods have caused hike in your sugars, whereas which foods have caused low sugars, or well-controlled sugars. So how these medicines are working, I suggest all type 2 diabetics to do that. And yes, and it makes our job easy because everything is crystal clear in front of your patients. There is no inter-observer or physician bias in making the treatment decisions for you. So that's the most important thing. Yeah, due to COVID, we are also facing some challenges. Many patients who used to visit us before in person, that is the preferable way, have resorted to teleconsultations. That's not a very effective mode of communication between a doctor and a patient. But nevertheless, it is going to be there. It is going to be there for foreseeable future as an alternate mode. But I believe now we are almost at the fag end of the pandemic. So the coronavirus pandemic, many patients are coming back to the clinics, and we are using sensors, and even regular interactions which we do with the patients are increasing. So I suggest whoever is vaccinated, they don't need to get worried about any other third wave or any other complication coming from COVID. So I believe the COVID pandemic is already in the end stages. So. Uh, but at the same time, you need to follow your COVID appropriate behavior, like wearing the mask as well as maintaining the social distance. These are the precautions. When you're sick, isolate yourself. If you follow this, I don't think we will see another wave in India at all. And how to weakness come down people. Sorry, SPH, I didn't quite understand your question. If you can report, that would be really great. Ms. Chaitra A. Are there any side effects with long-term usage of this device, doctor? No, ma'am. There are no side effects. It's a physical device which gets stuck with it. Yeah, rarely we notice some redness at the site. For people who, glue is causing some allergic reactions, but that's very rare. In Western countries, such reactions are much more for fair-skinned people, but in India, Asians tend to tolerate it much, much better. And even if there is irritation, we can remove it. It will not cause any long-term complications as such because this is just a monitoring device rather than it is not giving anything like an insulin pump. Insulin pump, if you don't manage it properly, it can introduce infections to your blood. So that's one thing which we always need to be worried about. You need to change the reservoir as well as the wiring set which comes with it every 3 days. So that precaution needs to be taken there. Whereas here, this is simply plug and play and use and throw. That is how it is. And Ms. Cynthia Prabhu, can this help in regulating my diet and exercise? Of course. Genuine people, we have had several non-diabetic patients walking in and asking, doctor, where is this sensor that everybody is talking about? Because obviously there is more media coverage. 2 days back, I saw one article in a dominant newspaper, Times of India, regarding the usage of these devices and all. Yes, it needs to become mainstream. Indians can benefit more because diabetes. We are the diabetes capital of the world, and by 2045, we're going to be the number one country with with the highest number of diabetics. So definitely, in our country, the usage, the cost is also very nominal in India. In US, it costs more, even though companies provide it because they have these insurance packages there. The co-pay itself is much more than what we pay here in India. So please keep that in mind. When we have access to technology, these companies are also reducing the prices, for our country, especially Southeast Asian countries. So yes, people non-diabetic. Coming back to the question, non-diabetic patients who come in just curious, to see where their sugars are. It has helped tremendously in changing their dietary habits and how the sugars are fluctuating during an intense exercise. All this information they are getting it, and then modifying their lifestyle changes like diet or exercise accordingly. It goes a long way in preventing diabetes. If a person corrects the diet and exercise, where the sugars are, which foods are causing high sugars, even if you are non-diabetic, it goes a long way in preventing, because in diabetes, if you prevent onset of diabetes itself, you are preventing the complications. You are postponing the complications by 10 years, let's say. So somebody developing a heart attack or a stroke in 40s or 50s, when they are the erring member of the family, and then laying paralyzed at home, wherein their children are supposed to help them out with the appointments or taking care of themselves, that affects the growth of the entire family. So as opposed to that, onset of diabetes in such person, the complications will come much later, 70s or 80s. When even then, if you manage it very well, there are many people, even with type 1 diabetes, which requires only insulin, 4 times a day. They have lived more than 70 to 90 years. Even in our Mohan's Institute itself, last month we had a felicitation in Chennai. So the patients who have lived beyond 70 years, born with type 1 diabetes, developed diabetes in the first decade of life itself, they went on to live without any complications 70 to 90 years as well. So the idea is to add good years to life rather than living the life or prolonging the life with the bad years, the bad quality of life. So diabetes is the only specialty I would say which works antagonistically to the physiology. Because person when we are seeing the patients, we try to control the sugars and thereby avoiding the need for cardiologists, nephrologists, neurologists, and ophthalmologists. So let's hope that we keep that way. We want to keep our patients to ourselves so that they don't develop any complication. With that said, if in the angio screening, if we notice anything major, we refer to the appropriate specialist. So as far because we can intervene early. Yeah? Some laser we can do through the eye to prevent vision loss. And if you notice an abnormality in the ECG when we ask to do yearly once, all diabetics needs to do that yearly once eye exam, heart exam, and kidney testing, and as well as legs. These are very yes, these are the four important organs diabetes affects. So every year, just like we do maintenance for our cars. So whether or not the car is running or not, we do the maintenance. We change the engine oil, we check the brakes, we check for the wear and tear marks, right? So yearly once you are supposed to check these four organs. So if you check these four organs, we identify certain signs like ECG changes. We suggest appropriate specialist to pitch in and then do the needful. Do a coronary angiogram before a heart attack happens and damages the heart itself. We can identify the site of block and then do a stenting or angioplasty there itself, thereby preventing a heart attack. Same thing with the brain. You can do a coronary angiogram and stenting, improving the blood flow before a stroke comes and permanently paralyzes the patient. In the legs, peripheral vascular disease, before a person's leg problem becomes more, getting pain or non-healing wounds, we can identify by doing a simple ankle brachial index ABI study, Doppler, a simple Doppler, handheld Doppler. It's a screening test to see whether the pressure with which your heart is pumping is reaching the farthest point of the body, that is the toes. So, what is the difference between the blood pressure, whether blood is reaching adequately or not? Because whenever any wound occurs, it needs blood to heal, correct? So, if blood flow is poor, we can do the Doppler as well as check for the nerves, biotissiometry, we call it. So, this is a simple test, which screening test, not expensive as well. So yearly once, if you do these, we can catch the complications early, even if they develop. So many diabetes in India tend to present late to the hospital. So late to the diabetologist, they would have tried everything, starting from home remedies, Ayurvedic, Baba's remedies, and then later end up to the doctor saying that my sugars are not controlled. Valuable time is lost. The damage would have occurred at that time. Our intention is to limit the damage at least from that point so that the patient don't develop complications. But inevitably, some patients develop complications because poor control. Early years are very, very important, more important than the later years in diabetes. So if you get diagnosed with diabetes, the first 5 years or even the first 1 year is very, very crucial. The closer you maintain your HbA1c close to 7.0, the higher your chances of escaping those complications. So I hope that answers. And sir, I'm diabetic. How to overcome my weakness? No, diabetes doesn't itself will cause weakness. If you're diabetic and you're having weakness or increase in urination and those symptoms, that means your sugars are really high. That's when you need to definitely come and meet a diabetologist to see where your sugars are and what type of medicines and lifestyle changes you need. Obviously, lifestyle changes come first, but when your sugars are so high that it's causing weakness and loss of weight and all, don't wait till that time. So every year, everybody above the age of 30 needs to screen themselves every year one time at least to see whether they have developed diabetes or not. We conduct camps. Of course, several camps are being done not just by our institute, everywhere. So utilize those opportunities, or you yourself remember on your birthday or a marriage anniversary to go to a center and get your diabetes screening. Diabetes, hypertension, and cholesterol. These three are the leading reasons for cardiovascular disease, which are the leading killers right now in the world. Not COVID, not cancers. So cardiovascular diseases form the highest. They form the lion's share of the deaths which are happening world over right now. Infections have come down, except for this COVID virus. Other infections are not that much. You still have infections, but the mortality, the lion's share of the mortality comes from your cardiovascular. So everybody needs to be careful about this. So, Mr. Sairaj Krishnamurti, is this device calculate my workout calorie burn, step counts, etc. Doctor? No, no, no. That's differently. Use your fitness bands, right? That will call your calorie burn. If you enter your height, weight, and what is your basal metabolic rate, and those things. These are the devices which will flat. But no, this will not give you the step count. This is not a pedometer. This is a improvised glucometer. So that is how you need to think about it. So, Ms. Cynthia, again, will this help patients who are on insulin to adjust their doses, especially those who are following keto diet? Yes. Keto diet is more of like a fad diet. It's like a fashion. Suddenly it goes and it comes down because it's impossible to sustain keto diet for long. How long will you continue? So, what I suggest to my patients when you're following dietary advice is whatever change you make, whether you're reducing the carbohydrates, whether you're adding fats, think that it is permanent. So, once you get the results, like, once you back to your previous diet and then be with the same weight. The weight gain will occur. So it's a matter of how much calories you are spending every day versus how much you are intake. If there is a net calorie deficit, definitely a person is going to lose weight. So if your goal is to lose weight, thereby achieve better HbA1c control with less medicines, yes, I suggest you follow a diet which you can continue forever, rather than just for some fixed time of time and then achieving your target weight, you can go back to your previous. No. So main problem with Indian diet is high carbohydrate, high proportion of carbohydrate. People think that avoid rice. When I tell them, they think they switch to wheat. When they tell you no, wheat also is bad, then they'll switch to ragi. Yes, ragi is also bad. When taken in high quantity. If you're taking more this much mudda in Karnataka and Andhra, these places, take this much mudde, they'll eat it only this much curry or protein, dal or any other vegetable. Needs to change. So simple technique, simple rule of thumb that anybody can remember. Carbohydrate should not exceed 25% of your meal, every meal of the day. Whereas 25% of the meal should come from protein-rich sources like dals as well as non-veg, eggs. These are the foods. Whereas 50%, the lion's share of your meal should and one fruit with every meal. So diabetics also can take fruits. So it doesn't mean once your sugars are somewhere in the border of 7 to 8 HbA1c, you can definitely everybody needs fruits for survival. It gives the antioxidants to prevent the damage which this cholesterol does, and those cholesterol blocks are formed right in the blood vessels. So that which fruits? Yes, that's the main thing. Mangoes, bananas, these pack a lot of carbohydrates in them. Mangoes, bananas, jackfruit, custard apple, as well as sapota, these grapes. These are the fruits which contain high amount of carbohydrates, even if that's why they taste so sweet, just like honey. So people with diabetes tend to consciously avoid these foods. But with that said, if your diabetes is under excellent control, you're somebody who likes mangoes, definitely don't no objection to not eat it when your sugars are fine. Just compensatedly, if you eat, suppose 2 pieces of mango on one day, try to avoid high carb diet in the next 6 hours. So in that way, your sugars may, you're giving your pancreas time, rather than overloading with glucose. So that's how everybody needs to follow that. And coming back to the original question, so how this helps in adjusting the doses? So this device, what I'm having here in my hand, is the Libre Pro. That's the older version. This one gives the data. It stores the data for 14 days, and when you go to the doctor at the second visit, and by using that reader, we can and grab that data and then read it. Not go back in time and then change that your sugars, correct? So this is not real time. So that is what changed with the Libre device, which is coming right now. It gives real time updates. If you wear a Libre sensor, it also looks like this Libre, but much less. Just margin. If you cut off the margins, you will see a small sensor, right, like that. So if you use a Libre, it will continuously transmit the data. If you touch your reader, that also comes with a reader, which is a different reader than this. If you touch the back of your arm while wearing this, let's assume this is my arm, and NFC technology, near field communications, all the data which is stored there will be pulled into this reader. You can immediately see what is your sugar, 85 or 210, and then that is where the live data is coming. Where what you can do with the data, if you are somebody who is knowledgeable how to adjust your medicine, and how to adjust your insulin doses, type 1 patients and gestational diabetes ladies who come pregnant, diabetes developing first time during the pregnancy, those people can adjust the doses of their insulins or tablets according to this data. So this new data is very, very important. It gives the live data. Anybody, even if you want to check 100 times in a day, it's free. Once you're using it, is pain free. So you can just touch it, but the cost is a little bit more. 5,000 rupees is what's going price for Libre sensor, and 5,000 for the reader. A reader can be used for any number of Libre devices. So if you purchase reader one time, that's one time investment, whereas your sensor needs to be replaced every 14 days. That also works for 14 days. Every 14 days, if you replace, you will have a continuous glucose tracking, which is enabled. So that is the main Libre. And coming back to the question here again, the insulin, how do people adjust insulin? Yes, it can also be used. The Libre newer version can be used to adjust the insulin pump rates also. So people who are on insulin pump is a small pump which is you keep it in the outside, in your pocket, pant pocket, or like a separate belt attachment. It's a small pump, just like a battery. It contains a battery, some amount of insulin inside it, the short-acting insulin called as Actifid or Norepid. So it will keep pushing the insulin slowly through a pipe. That pipe, where it will go to the abdomen. In the abdomen there will be a small clip in which will come into the beneath the skin. Every 3 days you need to change that, so it will keep pushing the insulin, set amount of insulin, 1 unit per hour or 0.75 units per hour. Slowly it will keep pushing under the skin. So what is the advantage of insulin pump? More or less you don't need to take injections, so mainly that is the advantage. And it's a comfort. Type 1 diabetics needs to take 4 injections per day. Along with that, they need to prick the child 4 times per day to know the sugars and then make the decision regarding the insulin. Variations are very common. So for type 1 patients or type 2 patients are also who doesn't want to go to the, who are dependent on insulin, so they also go for insulin pumps. So, how this works, this device works, the CGM device. CGM is the same what we saw, continuous glucose monitoring. This is the name. Another name is called as AGP, ambulatory glucose profile. So AGP is also another name for this. So CGM device, how does it work in adjusting the sugars? There is a beautiful concept called as looping right now. Okay, so insulin pump knows how much to dispense the insulin, correct? And this sensor knows what is the sugar. How about we make them interact together? So if your CGM device, the sensor, can communicate with your insulin pump and tell, hey, sugar is 250, dispense more insulin. And when your sugars are low, 80, it will tell the insulin pump to reduce. It can control the insulin pump. That is where this concept of closed loop systems or artificial pancreas. There is a third device which will communicate with these two, just like a mobile app. There is a Riley link transmitter in US. So people are hacking their insulin pumps to make it work these new CGM devices. So what is the benefit that they're getting? So they're wearing one sensor every 14 days, and they hack the insulin pump, so as to control it using their mobile app. There is a mobile app which they code themselves, and then they determine what is the insulin sensitivity factor and insulin to carbs ratio. So these are the factors that they need to insulin sensitivity factor, and for how much you need to have certain knowledge about this, technical knowledge and as well as coding knowledge to do that. If you do that, the sensor data will tell the phone, okay, this person's sugar is right now 200 unit, 200 mg per dl. And accordingly, it will tell that the phone will tell the insulin pump to dispense the insulin, virtually acting like pancreas. Depending of immediately, every minute it will keep tracking the sugar, and it will tell the pancreas to dispense insulin accordingly, thereby obviating the need for any manual intervention there. So there are many patients who are using it near, if you look at their CGM data, it will be like a flat line, always in the normal range, irrespective of what they eat, irrespective of what they do. So their HbA1cs will be like, machine controlled. So that is the beauty of these, sensors as well as the insulin pumps. I am saying in the next 5 years, we will have a FDA approved, professionally available, marketed by a professional company, one artificial pancreas system, which is going to maybe cost a little, maybe cost more in the initial stages, but that is going to cure type 1 diabetes. There is no more injections for the children, no more monitoring. So that sensor itself will monitor and dispense the insulin accordingly, thereby eliminating the main problem with diabetes. That is, your pancreas is not producing insulin according to your sugars. So that is the scope of this sensor technology. And with more news coming in from the big tech sector, Apple Watch, Apple Watch is also in works to with several other Dexcom C8 as well as another competitors for about in US. They are coming up, planning to come up with watches which you can wear and then it can track your sugars. And then just like with the Apple Watch 4, we have this ECG monitoring. It's not completely replacing the traditional ECG. It will take a much longer time to replace that, but still having some information by just wearing a watch about your sugars. And Google is in works to produce contact lens, which can transfer your sugars, which can tell you how much your sugars are continuously. So these sensors are the future. Even the big tech is investing in them, and the doctors are also very happy that we are able to control the diabetes in a much better manner compared to what we used to do before. And but still in India, there are still the basics are not right. People have no knowledge about screening themselves and presenting early to the diabetologist, right person, right time. That is missing. So let's go back to the questions. I believe there are very few questions. Please, post any questions related to the diabetes, not necessarily related to this sensor. So I'd be happy to answer all those questions for you. So, Mr. R. K. Naidu, it's useful. Thank you for your suggestions and assistance, sir. Thank you, sir. So once we download all the data, how can we interpret to control our sugars? Yes. So this sensor, when you use this sensor for one time, 14 days data will be loaded, stored in this. When you take it to the doctor, wear it to go to the doctor wearing that, our technician will use this reader to get the data. So once we get the data, then we will see how the medicines, what are the current medicine the person is taking, and how they are working. So in many a times, I can show you many CGM data, but that contains the patient numbers here. So I refrain to do so here. So if you look at that, nighttime sugars going low, it's a dangerous trend. I have lost one patient actually. My patient's husband, one lady walked in last 3 weeks back, and saying that she lost her husband due to low sugars, which occurred in the middle of the night without knowledge. So these kind of deaths we can avoid, and then even patients who are having low sugars in the middle of the without knowing, we can insulin and then make adjustments so that they never go low in the sugar range, and at the same time achieve the HbA1c by controlling the glycemic excursions, means rises in the glucose as well. So this is how interpretation is done by a diabetologist only. So please, type 2 diabetics and others don't think that you can use this center and monitor yourself. It's very, very difficult. There is some amount of technical expertise which is required in order to interpret those. That's where your doctor comes into the picture. So please, I highly encourage them to use this sensor and then take the data to your doctor so that your doctor can interpret. If you are there are some of my patients who are type 1 diabetics who have gone into coding and made these closed loop systems for them just to work. Some of my patients are using that. So those people have the knowledge. If you have the knowledge and the confidence and if you invested significant amount of time, months to years, then yes, you can, no doubt you can adjust your sugars and lead a diet which is disease free, complication free diabetes. And Ms. Varsha, is it available in Indira Nagar Mohan's clinic? Yes, we have this technology for the last few years. So we even have the latest Libre as well. So definitely we use it as an integral part of managing our patients at Dr. Mohan's Diabetes Center in Indira Nagar. So if any of you need, if you are in Bangalore, definitely feel free to reach out to us. And we also have 50 branches all over India. Dr. Mohan's Diabetes Center, rated as the number one diabetology centers in India, even surpassing many institutes, teaching institutes, the premier teaching institutes of India. So, we have 50 branches all over South India, predominantly South India, and as well as in Kolkata. So you can reach out if you are from any of these areas. You can definitely reach out to us. Come walk into our clinics, secure an appointment to our call center, and come back. Or you can even take a teleconsultation. People up in North, if you're not happy with your control, diabetes control, or you want to try this, yes, we have tie up with these companies which actually make these devices to make it available. We can arrange somebody to come to one of your cities, even if you are from the North India or anywhere. We can arrange for the company's representatives to come to your place and then attach this device. And then once the data is out, they'll send it to the doctor sitting anywhere in the world. So utilize the technology and get the best out of technology and manage your diabetes better so that the complications are less. So you live a life which is complication free, meaningful. So that is the main motto of our Dr. Mohan's Diabetes Center and doctors. And I believe that that's the end of the questions. So if you have any more questions regarding general diabetes management, if you have even questions like what else can be done to better manage your diabetes, please feel free to ask the questions. So hmm, I think today being a festival, there is a little lackluster presence of people. Last time we did, it crossed 1.5 hour continuously. We exceeded the time, and even we had to stop. Questions were pouring in. And I hope you're all having a great Janmashtami. So COVID. So let's talk about COVID also. If not many questions. Yes, COVID has undoubtedly led to increase of diabetes. As you have seen, people have started using rampant abuse of steroids in India. So every doctor or every RMP or anybody, if you go with fever, they started writing steroids. You've seen what happened after that in the months of March, April and June, March, April, May, June. So, these patients who were started on steroids, steroids are basically hormones which increase your sugar levels. So sugars went really high, and we saw black fungus cases being reported in India only. So same Delta variant which is present in all over the country, now it has moved to all the world, all countries in the world. But because of mismanagement of the so-called crooks of our Indian system, so I'm not saying everybody managed it bad manner, but many a times we have seen the timing, the dose, and the duration all are incorrect. So, not in acceptance with the international standards or the guidelines or the data which was available at that date. So, see all the other countries, we are not hearing about black fungus cases. Why only India? So, it matters where you keep your trust these days. That is what I keep telling my patients. Who you trust, don't trust blindly. Go with, do a bit research and your homework in, deciding who you want to trust. So, that's the most important thing. Yes, COVID has increased the chances of diabetes for many people. People who would not otherwise develop diabetes for the next 5 6 years, because the COVID came and destroyed and caused some damage to the pancreas. Just like the way it damages the lungs, it damages the eyes, all saying that this damaged this part. Just like that, it damaged the pancreas and caused diabetes to develop much earlier. So definitely, what happens when you get diabetes earlier? The complications also come earlier. Imagine that you managed it very well. So diabetes comes 5 years sooner. Complications come 5 years sooner. So that is the main thing we want to avoid. Unfortunately, in this pandemic, there is an epidemic of diabetes which is coming. Many patients are coming with higher diet, exercise, and then screening. These three components which will identify diabetes in the pre-diabetes stage and delay the progression to diabetes, thereby postponing the complications. So, Mr. Rajkumar, sir, can a person with diabetes eat dark chocolates? Why not? Why not? When your sugars are under control, no food is prohibited. Sugar, mangoes, but they are great foods. Dark chocolate, if you really like dark chocolates and you want to just is below 7. Monitor your sugars. Food you are eating. Maybe instead of a snack, you can have a little bit of chocolate. That's fine. So it's not going to shoot up your sugars. But monitoring is key. If you are somebody, if you eat small amount of chocolate and then sugar shoots up to 250, 300, then it's not advisable. It depends on the person to person. So definitely the CGM also will have pick up that that trend. If you have eaten, you want your party, how high the sugars went, it will monitor. When you are partying, this will silently monitor your sugars. Is there any app available for reading the AGP? Yeah, Glimp. Glimp is one app which is more commonly used. It has uh, in Western countries, many people started using third-party softwares. I believe there is even a hack to extend the life of the AGP sensors. That is the Libre. Libre Pro. There is one patient channel who I follow. Ted One Talks. So he is a type 1 diabetic. He is around 28 to 30-year old. He keeps posting these videos. I follow patients' videos also because I want to see this diabetes, how they are adjusting to this in Western countries, so that I can find solutions for our own people. So if you look at him, he has posted a nice hack, nifty hack. So what it does is, before these 14 days, when your sensor is going to end, almost you have only just 30 minutes of life, there is a code which you use to enter in the mobile app. So that will effectively reset it. Maybe this was a feature which was kept by the people who developed this for testing purposes. So effectively, sensor. So every month only just 5,000, and yes, you can monitor your sugars continuously. That's better. It effectively halves the price of the sensor. So I'm not sure whether that hack is still working. Yes, there are many apps as well where you can transfer that AGP data. It doesn't. I don't think it will work with the Libre Pro. Huh? But Libre, yes, there are many apps which will pull the data. So we're using an NFC. If your phone has a NFC, near field communication, NFC feature enabled, you can use your phone itself to pull the data from that instead of using a reader. So that is the technology. But going forward, we need the sensors also will evolve. I believe they'll also evolve so as to be more friendly. It will come with an app. It will work for longer times with better accuracy and without the need for any readers or third-party transmitters like meow meow. So these things it will directly give the data in the phone like a live screen, like the stock market going up and down, just like that. You will see how your sugars are going up and down, and accordingly take your call regarding your diabetes management. So thank you and valuable advice. Thank you, Chetan. Impressed with I am type 2 diabetic. Looking forward to seeing you with the reports. So definitely, you can definitely call our center heads. There is a call center. You can simply Google. My suggestion is better take the appointment because diabetes is one specialty where we rely we check the BP there and there itself and then take the advice regarding what needs to be done to manage. But with that said, diabetes is a dependent on your blood test values and the accuracy matters. Don't go with any other lab which says that we can provide 72 tests with 1 rupee cost. You all know how the quality is going to be. It is not sustainable in the long run. When there is no fee, you are the customer. So that is the motto. So trust. I'm not saying just with Mohan's. Trust the labs which have been there for a while, which have made the provisions to provide the quality. Enable accredited quality is being NABH accredited quality is being provided. So definitely quality incurs costs. There are plenty of technicians where they need to involve cost of the app, equipment and the real estate. All these things will add up. The bills, monthly bills, all these things, and there has to be a certain price below which a good provider cannot bring down that is going to affect the lives of the people who are working in that organization. Whereas the startups, there is a lot of money coming from China, Japan, venture capitalists pouring in the money to acquire the customer, showing that reports. But don't fall for those. Maybe that's a short term, this thing. It is only there for the short term. It is not sustainable to provide such a cheap cost by sacrificing without sacrificing quality in the long run. So that is what I would suggest. Any more questions from the audience? Please go ahead and post. And if no more questions, we'll close it in next 5 minutes. I hope some of my discussions are helping you and or somebody who is a diabetes or your parents or anybody is diabetic. My intention is to help people with the knowledge because tablets, rather than trusting blindly what tablets are to be taken with anybody, I want my patients to be knowledgeable. Why this diabetes comes, why I need to control, what if I don't. These things can be done to better control my sugars. So not just the sugars, so we focus not just only on the sugars. I'm a physician before I became a diabetologist. So we check the BP when I come. Blood pressure also needs to be controlled because that is also affecting the same organs. Blood pressure needs to be monitored, and controlling your cholesterol, which is the reason why there is blocks form and leading crosses 100. So if it crosses 100, starting a small dose statin, you see many of the people after getting heart attack, they get started on statin by a cardiologist to prevent other lesions from progressing. Other blocks should not increase. So why don't you do that when you are diabetic itself? When you are diagnosed with diabetes, all the international guidelines and all the practice which is done in Western countries, it is basically you need to start a cholesterol lowering tablet when your LDL crosses 100. Simple, Google it yourself. LDL target in diabetes, you'll see value of 100. But majority of the times, diabetic patients who come and gets followed with their physician or a diabetologist for years together, they come with LDL values more than 150, 160. So all that valuable time is lost, even though you are controlling sugars, but you are not doing anything to prevent the blocks from happening in the heart and major organs. So This is important. You need not just only focusing on glucose. You will miss out the larger picture. It is the patient who needs to live life without complications. So what you need to do is not just look at the sugars. Ensure that every time you screen the patient for hypertension, the blood pressure is more than 140/90. You need to be started. Explain the disease. What is the nature of the disease? Why this is hypertension? It's not related to your anger or anything, and it's not something which you can control. So these points needs to go into the brains. That trust needs to be developed. So that's the reason, trust your doctor. Don't blindly trust again. So that's the main message I want to give to our patients and audiences who are listening to this today. Miss Susan Margaret. Yeah, sorry, Miss Varshad Masarapo. Do you treat patients with gestational diabetes? Yes, this is also diabetes. That's why we are diabetologists. We are trained to treat that, and we have qualified dietitians who will make you a tailor-fit diet, because diet is the most important thing. In pregnancy, the scenario is a little different. We want stricter control more than if you are in an ICU. ICU, there are targets, right? Fasting sugar needs to be below 100. In pregnancy, it is below 95. Below as close as possible to 90. Why? Because the bad effects of these high sugars on the fetus and the baby, not just the mother. Mother will develop diabetes later. Gestational diabetes is just the trailer. Cinema will come after 5 years, just like that. After 5 years, many people will develop diabetes type 2. Whereas, if you look at the long-term effects on the babies who were born to mothers with gestational diabetes, they tend to develop diabetes in the elderly age, and they are also prone to birth anomalies. Also, congenital defects also are more common if mother sugars are high during the pregnancy. Yes, CGM is an integral part. The sensor, what we talked about, is almost a rule rather than an exception in patients who are having pregnancy wants to know their sugars on a real-time basis, because they can control the diet and accordingly they can give the insulin, because insulin is the main choice of treatment. If somebody has diabetes during the pregnancy, insulin is the mainstay of treatment rather than any tablets which are not proven to be safe in pregnancy. Miss Susan Margaret, good evening, doctor. One of my friend who is 51-year-old and she is a diabetic. Her weight is 50 kgs only. Okay, okay. How can she gain her weight again? Any possibility? Weight loss, mainly there is no rocket science behind weight loss unless there is a medical disorder which is causing that. But medical disorders causing weight loss or weight gain are a bit rare. Most commonly, weight loss, thyroid needs to be ruled out, Ms. Susan. So, excess of thyroid can cause weight loss in a person. And again, excess of diabetes, excess of sugars also can cause weight loss, because pancreas is not producing insulin. Insulin is an anabolic hormone. It builds up the body. It adds weight to the body. If somebody's in pancreas stops working, they lose their weight. So that's important. And how can she gain back her weight? Again, we need to rule out this diabetes and hyperthyroidism in this patient, and assess the calorie intake, whether she's unknowingly or knowingly taking more calories than what's required, and then formulate a diet plan. And with medical nutritional therapy. So medical nutritional therapy means after ruling out medical disorders, we formulate a plan by working with a dietitian. Dietitian will then convey and then follow up with the patient in order to gain back the weight. So there are plans to weight loss, lose the weight as well as gain weight as well. So majority of the times in diabetes, we want to lose weight. So anybody who is thinking that they're underweight and tries to, if I put on some more weight, I look better. No, my suggestion is no. We have genes. After a certain age, those genes will be switched on, and your sugars tends to go higher. So that is the weight gain will definitely worsen that trend. So my suggestion is do not attempt to gain weight unnecessarily. So, Mr. Jagadish Mundluri. So, good evening, doctor. Is there any special diabetes clinic for young children? Yeah, we handle routinely type 1 diabetes in our center. Last week itself, we had a patient as young as 2-year-old coming. So, coming into a clinic for type 1 diabetes. Type 1 diabetes is something which requires insulin for life. Without insulin, they will not survive. So, but with that said, yes, insulin has come a long way. It's been 100 years. Insulin. This is the 100th year insulin was discovered. So, we have better insulins right now. So somebody who's born in 2000s, after 2000s has a higher chances of living full life as opposed to somebody who was born in the 1910s or 1920s. So we have beautiful insulins which require minimal effort from your side. Beautiful pen devices, pharma industry innovations Many people, you know, has a negative opinion about the pharma industry. Definitely, they are there to make profit. They're not for charity. That's for sure. But think about it. Who did who saved the world during this COVID crisis? Is it not the pharma companies? Yes, pharma companies discovered the vaccine in a most in the fastest manner. Within 1 year, they were able to produce it. It's not any other section of so doctors we were there only just to give the steroids or give try we can manage the patients on ventilators and all, but completely defanging the coronavirus by removing the fangs and making it like a infection is the job done by the pharma industries. Don't hate them for that. Thank them because they're also whatever profit or not. Definitely, vaccines are working really well. All the vaccines are really working very well. So don't hesitate to take any vaccine. Irrespective of your diabetes control, please go ahead and take your vaccine. That's the only way because it's become endemic now. COVID has become endemic in our country. So it can come back to you 1 year down the line when people take off the mask and go into society when mask mandate is not there. Still, people who are prone, means who are not vaccinated, they can catch it. And then the disease will take the natural course with 1.5% mortality rate in non-diabetics and 15% mortality in diabetics. So, don't take chances with your life. It's not worth it. So whatever maybe you believe, please go ahead and get your vaccine shots. So whether Covaxin, Covishield, Sputnik, or any other vaccine, J&J, please go ahead and get your shot done and be safe from this virus. So, Mr. Chandran Selvi. So, HbA1c report 6.7. Okay, sir. No. Absolutely no. 6.7 is diabetes. So, if you are waiting and seeing that my diet alone will cut, no, you are making a mistake. Definitely, age of the patient is very important. Suppose somebody in the age of 80 develops 6.7. Yes, I would not be very aggressive in managing such patient because life expectancy is low. Whereas somebody in the 30s or 40s develops this HbA1c of 6.7, they have a very, a longer life ahead. So we need to control the sugars as tightly as possible in such patients and keep the HbA1c below 7 or take metformin. There is underlying other causes like weight gain, excessive weight, obesity is there. Control it because sooner or later that is going to diabetes is a progressive disease. With age, just like the way your hair falls down and your eyes become weak, your skin wrinkles, pancreas also becomes old with time. And definitely you need your HbA1c starts rising. You need more and more medicine with time. And some of the diabetics, 50 to 20% of the diabetics, it comes to a point where you need insulin as well in type 2 diabetes. But in type 2 diabetes, that's the most common variety of diabetes. Insulin is used only for a selective patients who are unable to control the HbA1c, unable to control their sugars despite two or three drugs. And any other special conditions like gestational diabetes or patients kidney disease. These are the conditions we think about starting insulin. Definitely HbA1c 6.7. This is the time to act rather than worrying about later. You want to live your life after 60 without any complications. This is the time to act. Ms. Tejarani, good evening, doctor. Post-COVID diabetes changes are there after COVID? Yeah, definitely. More cases are being reported. Diabetes is, we have, as I told you earlier, there is a epidemic within this pandemic. Within the pandemic of COVID-19, there is an epidemic of diabetes which is going to come and hit us. And this epidemic is going to be there for decades. So it's not, there is an estimate I said earlier, 2045, India was going to be the number one country with the highest number of diabetics. So, definitely things are going to get worse before they get better. So, consciousness, diet consciousness, and fitness. So many of you, half an hour of activity minimum per day. So any activity, cycling, jogging, walking. So wherever possible, avoid usage of motor vehicles. If it's a short distance within 5 kilometers, you can use a cycle. Yeah, many people within cities they can commute to their works in cycles rather than cars or motorcycles. So in fact, I'm doing that. If you come to my center, you can see I'll always come there on cycle. In my Even though I commute 20 kilometers, that's very much doable. Even you need to be open-minded to see what you can do. So that's what I suggest to all my patients as well. Hmm. Thank you, sir. Mr. Jagadish, Ms. Rima Sahapatar, good evening. Yeah, Miss Rima. Uh, Session, maybe another 2 minutes. And please feel free to share this video. There will be a this will be a recording as well. And please share widely to your friends or family members who you think can benefit. Huh? So knowledge is something which increases when shared. When shared. So please this to all the people who you know. Huh? So we need to make this country, uh, free of diabetes. So diabetes free India is what we want to see in our lifetimes. Lifetimes. I believe no more questions. So thank you very much for taking your time out to attend to my live session. I hope this session is turned out to be useful to majority of you. Thank you very much.